just want to know who Thalia is before she was a medical student.
My name is Thalia, as I mentioned. I was born in Peru, and my family and I moved to the US when I was 5. My dad did a lot of work taking care of sheep in like random areas of the country, and my mom stayed back in Peru selling a lot of her produce that she would actually grow in her little town. So my uncles realized that that wasn't a really good life for me because I wouldn't see my parents very often. So thankfully, he invited us to come to this country, and that's kind of how we ended in the Central Valley. I grew up in small little towns called Los Banos, Gustine, really, really rural towns. And I lived in Gustine until I was 18, until I moved to college at UC Irvine, majored in biosci. I didn't really know other majors that I could, take to become a doctor. So I just did bio and I graduated. Wasn't sure if I was still going to go into medicine because my GPA wasn't the best. So I took a year to do extra classes. I also worked as a scribe, did my master's program before matriculating at Western. And now I'm here. It seems it's still taking me a little bit of time to realize, all the things that I've been through to get to this point. But I'm so thankful to be here and now being able to share this with everybody.
Given you just matched, did you find it difficult to match into psychiatry coming from a DO school?
To be completely transparent, I think as a DO student, there's still a lot of bias towards us versus MD students. I'm hoping that that will change with time because we are the same classes, we go through the same rigor. The biggest hurdle that I faced as a DO student applying to residency was that my school didn't have a lot of big institutions, hospitals, and schools have an affiliated hospital where they do rotations and stuff like that. So for fourth year and even third year, some of my friends had to kind of figure it out where to go. We had to apply out to go to different rotation sites and stuff like that. And in terms of psychiatry, when I looked at different statistics programs, especially big academic programs,
Hmm.
very minimal. There's not many DO students or DO doctors there. So I do think there's a little bit of bias, but it just depends on all the different programs, what they want for their cohort, what kind of student they're looking for. And I'm hoping that with time, as more students end up going to DO school, that we can have more DOs in every specialty because we're equally as competent.
Hmm.
And I just hope that for the future.
What do you want to do? And well, one is what inspired you to want to do psychiatry? Because you could have been any type of doctor. And what do you want to do from 10 years from now? What do you see yourself doing as a practicing psychiatrist?
Yeah, so how I mentioned earlier, when I, got into med school or started med school, I had a lot of mentors that were family medicine doctors. So that's kind of the field that I knew. I didn't know any psychiatrist, but it wasn't until I had always had this interest for mental health. One of my friends, unfortunately, committed suicide, and when he was in high school. So I always had this idea, like, why did he do it? Like, what could we have done different? So that was always in the back of my mind. And I've always been this person that likes to talk to people. My friends are always coming to me for like advice. And I feel like people open up to me very easily. So I think it's just this nature that I have of myself. But it wasn't until my second year when one of our family, actually, no, one of our psychiatrists, our professors, she said, when I went into family medicine, I thought that I didn't get enough time with my patients and like I wanted to like know more about their mental health and stuff like that. So I was always between like family medicine or psychiatry because I know there's so much need for mental health even in primary care. But then there's also this side of me like I want to be able to treat acute patients by being a psychiatrist. So I was always between in both. But I think what I love about psychiatry is that you can help people from all ages, especially if I want to when I want to be a child adolescent psychiatrist. I think there's so much need that a lot of kids need help. I think a lot of kids need mentors. I think a lot of kids often face really bad situations when they're young, and that often dictates their future as adults. When I sometimes see my patients that are adults in the hospital, I realize like what could have happened if you got care sooner? What would your life have been if you were diagnosed with whatever earlier on? How could your life have been changed? So that's why I'm drawn to child psychiatry. And for the future, I would love to work at a juvenile detention center with kids at foster care, kids that are in the system, kids that look like me, that come from minority backgrounds. I think that's where my heart draws me to, and for the future, that's what I hope for myself.